Ladies and gentlemen,
this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week earned his Doctorate of Dental Medicine degree in 2006 at Boston University's School of Dental Medicine. In 2019, he was inducted as a Fellow of the International College of Dentists. He is a co-founder of medical technology startup DemiDoc, a platform focused on health outcomes in dentistry, medicine, and mental health. Currently practicing from Kyle, Texas, please welcome Dr. Jose Alamo, DMD, FICD. How's it going, Dr. Alamo?
Oh, just fine. Thank you for having me, Brandon.
Yeah, it's great to have you on the show. Thank you so much for taking the time out of your schedule. Now, jumping right in, at what point in time in your life did you decide to get into dentistry, and when did you think to yourself, boy, I really want to become a dentist?
You know, luckily I knew early on that I wanted to go into dentistry. I met a mentor. I'm from El Paso, Texas, and so I was working with an attorney as a runner a few summers in high school, and I knew right away I didn't want to get into law. And one of the associates there had a friend who we went to high school with that was a dentist in town. He said, "You should go visit him. He's a real nice guy, and see what you think." So I went over there and met Dr. Daniel Castro, still practicing today in El Paso, and really liked the way he was able to have a profession and have a life outside of the profession, and still excel in what he dedicated his life to. And so from that point, must have been maybe about 18 years old or so, I said, this is what I want to do. And I'm still in touch with him today. And that's it. Early on, I knew. I speak with a lot of college students, and they ask me the same question, and they don't know what they want to do. They change their majors halfway through college, so I think it's just fine. It's the time that you learn what you like. Yeah. And for me, I just felt lucky that I knew that I wanted to do this, and so
that's awesome. Yeah, where did you end up attending school?
I from El Paso, I went to St. Mary's University in San Antonio, and ended up going to Boston University out in Boston, Massachusetts, and it was really awesome. Having never left Texas up until that point, I was about 20 years old, and being the East Coast for the first time was a very different experience, but it was a great experience. And so I went to Boston University, and I was out there for about 4 years.
And when you came out of school, did you start off as an associate, or did you purchase your own private practice?
No, and I hear that some students will do this right out of school, and not me. I went into a residency. I did a general practice residency in New York City. I did what's called a GPR, surgery based. At that point, I either want to do periodontics or go into oral surgery, and was learning a lot about implants and wisdom teeth removal and some sedation. And so I did that I did a 2-year residency, one at Kings County in Brooklyn, and another at Cornell in Manhattan. From there, I knew I wanted to go into public health for a few years. And so I did that for about 5 years, and that was a really, really tremendous experience. Really got to work with a population that I know well, and felt like I can give back a lot during this time. And then after that, in about 2012, I opened my practice in Kyle, Texas, with a very good friend of mine, now business partner. And we've been here now 8 years. We're coming up on January.
Excellent. Yeah, Dr. Alamo, also I see down here that you had done some volunteer work in Nicaragua and Panama. Can you tell us a little bit about that?
Oh, yeah, this has been a very cool experience. I go with a group out of the Northeast. They're mostly from Boston and Rhode Island. It's a big group of providers, included our dentists, physicians, audiologist, optometrist, and physical therapist. And the last time we went, there was 80 volunteers.
Wow.
But we started off by going to Nicaragua. I jumped in about there maybe 12th, 13th trip, and they go every year. And I've been lucky to go with them most years. So we went to Nicaragua twice, and now been to Panama about 5 times. The last time I went, in 2018, we were able to treat over 800 patients in the dental department alone.
Wow.
And it's been super cool. Yeah, we'll go to a remote part of the area. Most of the patients there wouldn't have access to a dentist otherwise. They would have to drive into Panama City, which can be quite far and expensive. Believe it or not, some of the dentistry costs the same in Panama City as it would perhaps in some parts of the United States. And so it will be unattainable. So we're able to do some good work. And now the group goes back yearly, and we can see the same patients sometimes and see how they're doing,
that's awesome.
do exams, and hopefully in the next few years we can start doing some more comprehensive work.
So do you go every year?
I haven't been able to, as I've been getting involved in things like the Hispanic Dental Association, and then in my startup. But I think I'll be going not in 2020 but 2021 again. I'm looking forward to it. I definitely miss being out there, and you definitely end up taking more than you give. I think it's a natural thing that happens, and I hope that as my career goes on, that I'm able to do more to do more social service work, like being able to be in a position where I can do dentistry for potentially for free.
Yeah,
but that's kind of like a lifetime goal.
That's awesome. Do you know if there's any plans to expand out to other countries or?
Not right now. It can be difficult to organize these kind of trips. We take all of the equipment to these countries. When we went from Nicaragua to Panama, we had to hire a driver to take all the equipment, drive through terrain, and we met him in Panama. Otherwise, we work with dental supply companies, and they donate a lot of things, the composite, the bonding, and we have to carry all that with us. We have to work with the government, the local government there, showing our diplomas, that we're actually licensed dentists in our states.
Yeah. And
without that partnership with the government, it would be very, very difficult. And so I think that's the biggest hurdle you would have to jump by going to another country. Right now, we work with the Rotary Club there in Panama, and they're able to do a lot of the groundwork. So when we get there, we can have the patients and the facilities to work.
So along the lines we were talking about, can you tell us about your involvement with the Texas Mission of Mercy and Hispanic Dental Association clinics?
Sure. Texas Mission of Mercy has been around for a long time, and I keep out, basically, I look out for emails that they send out, and when they're in our area, within 200 miles or so, I'll volunteer. And they have a great clinic going on. They must do anywhere between 5 to 8 cities a year, and that's a really cool program. I know that they'll do dentures day of for patients, and that's typically that will be as you know that could be a month process, if not longer. The Hispanic Dental Association, I'm the treasurer for the national association, as well as co-founder of our local chapter. And so whenever the opportunity arises for me to volunteer at a clinic, like I do in San Antonio for Veterans Day, most years, I take the opportunity to go and give. Excellent.
Now, kind of reeling back, when it comes to your own private practice, how can you describe the layout of your practice, and how have you made it grow throughout the years?
Yeah, so the city of Austin is growing tremendously. And as an effect, the small cities or towns around there are starting to grow as well. I think this must have happened in California 20 years ago, and it's happening here now.
Yeah.
And Kyle is one of these cities. It's right in between Austin and San Antonio. And we came out here. There must have been about 27,000 population, and it's grown close to 40 or 42,000. And the projection is that it will continue to grow. So we built our practice here and started with 2 operatories. We had built out for 6, but we had plumbed 2, and we worked out of there for most of the first year. And we started to add chairs as we had increase in new patients coming through. And now we actually operate from all 6 chairs. We have 3 hygienists. Our team is 11, and we're moving and able to do implant surgeries, bone grafting surgeries, wisdom teeth removal. And we have a prosthodontist who comes in about twice a month, and he's doing full mouth reconstruction here on patients that would need it. If we didn't have them coming in, we would have to send our patients up north, which could be, an hour and a half for, 9 times out of the year. So it's a big service for him to be able to come down here for our community.
That's great. Now, in doing that, do you have a certain marketing strategy that you're using, like mailers or social media?
That's an interesting question, because when we first started, we didn't know much about marketing and branding. We don't learn about this in school, public relations. So a lot of the knowledge that I've gained has been through looking through websites and seeing how other doctors are doing their marketing. We've done primarily a grassroots kind of campaign. We go out and we go to a lot of local events, community fairs. We do a lot of dental education whenever we can. We also go as a team to the Texas Food Bank and help hand out food. Awesome. So we try to really be engaged with the community and have allowed our practice to grow organically. We have used reviews to help us. We work now with Podium, and Podium, they text out our patients and they write reviews for us, and they've been very kind. And I think through those avenues and through what we do, grassroots level organically, patients can kind of feel that and say, this is the kind of place that I would want to go get treated. And other than just being kind, chair side, we let the word of mouth kind of dictate our growth, and it's been slow and steady. But I think that when you build things this way, they last, and that's been our strategy really. We do one local newspaper, and they work with businesses, kind of like the heartbeat of the city, and where are the new restaurants, where are what's gonna be built in these areas. So we do a small advertisement there, and that's given to all the residents here for free, and so they can see us there. But haven't done mailers so much, and I really think most of it has been unorganic, kind of referral based.
That's great. Yeah, awesome. Now, Dr. Alamo, when it comes to doing procedures, do you have a certain procedure that you prefer to do more than others? One that's, say, your favorite?
Yeah, I really enjoy doing a lot of surgery. And so as it pertains to implant and bone grafting, wisdom teeth removal, I really enjoy the working with these procedures. The removal of teeth, you do it and you're done, and everything heals up just fine. With the implants, when you combine that with crowns, we're really able to really change the way somebody looks and how they're functioning. And I like that we're able to do that. And bridges are good when they're necessary, but if we can get implants in, it's really we're giving something back to the patient they didn't have before. And so I really enjoy implants and what it's meant to our practice and to dentistry as a whole. And I know more and more general dentists are doing them. They're a very predictable treatment option, and I'm starting to do guided surgeries with stents, and we're able to place those implants in practically the most perfect position, and that's been a very enjoyable process, planning those out and then putting them in.
Great. Yeah. Now, just to get your thoughts on this, Dr. Alamo, what are your feelings about these new impression scanners and CAD/CAM technology in dentistry?
Oh, very cool. Yeah. So we have a 3M digital scanner, And I think we were all, doctors and staff included, like, how are we going to integrate this? Who's going to get good enough to use this so that it becomes an efficient part of our treatment process? And we have staff members now that are able to use it. They're able to take the scan under 2 minutes. And we've grown from using it to single tooth restorations to doing bite cards with them, to doing both arches for clear correct, which is what we use at our office. And it's been amazing. I think that the literature says that it's 97.8% accurate. And I found that when I use it and we seat our crowns, because sometimes I have to take traditional impressions. When I use it, when I'm able to use it, that those crowns seat with minimal to no adjustment. And likewise, we were doing traditional impression methods for clear correct. And when we started using the digital scanner, they were popping in beautifully. And so I'm a big believer in digital scan. And I think it'll be the standard of care, if it's not now, in the near future.
Yeah, well, that's great.
Yeah.
Do you have any other pieces of equipment that you've recently added to your practice?
That one is probably the most recent, and then adding implants, as I mentioned. But I think the next thing we're going to buy is a CBCT. And right now we refer out to a local dental office to do our CBCTs. And I just find I have this big stack of CDs in my office right now, and I was like, we're needing it, we're using it. We need to get one, and that's really going to be the next bit of equipment we hopefully get in the next several months. But as far as planning for implants, as you know, and then also seeing where the inferior alveolar nerve is, for me, taking out wisdom teeth is another huge benefit. And yet another piece of equipment which I think will be standard of care in dentistry in the next several years.
Yeah, most certainly. I have to agree. Now, I see here that you were recently entered in let me try that again. I see here recently you were inducted into the ICO. Just want to say congratulations on that. Can you tell us a little bit more about that, Dr. Alamo?
Yeah, that was a huge honor. And they're looking at dentists that have given back to their community and that continue to do so. And it's pretty awesome that somebody was able to look into my resume or the things I've done in the past and decided to invite me into this group. And it's good to know that you're in good company and that people are saying good things about you. It was unexpected. I didn't apply for this. People were recognizing that my work in working in Central America, and then through organizations like the Hispanic Dental Association, that they thought that I should be part of this fellowship. Huge honor.
That's pretty cool, especially like you're saying, when you don't even realize it's coming, and then you get that. Yeah,
it's really cool.
My producer had actually shared some notes also about this app that you created. Can you tell us a little bit more about that?
Yeah, that's been really cool. I've been working a lot on this. It's my startup called DemiDoc, and we have co-founders. One of my co-founders is a gastroenterologist for pediatrics, and my other is our CTO. Used to work for Apple, and we've developed this basically a telehealth platform. But we're most interested in health outcomes and how we can use this platform to improve health outcomes. We'll be using the platform in El Paso, Texas, where I grew up. And right now, primarily, it's used in medicine. But I do use it in my office. I do a lot of post-ops for implants and also for my surgeries. And it can be a very effective tool. I like seeing my patients after surgery to see how they're doing. And oftentimes it can be a burden for them to come in, especially if they're feeling just fine. But this allows us to touch base. It allows them to see me. I can show them diagrams if they want to learn more about some symptoms they may be having. And it's like that one extra step outside of a phone call, and where we can see each other.
Yeah.
I think in the future there'll be a huge opportunity. And these are kind of like big ideas, where everybody in the state of Texas or throughout the country would be able to have access to getting teeth cleaned, getting an exam, getting sealants placed and fluoride applied, and having that part of the population that has cavities go to the dentist. And so this would minimize a lot of travel, especially for those people living in rural areas or who don't have mobility to get to the dentist. For example, if we did screenings in schools and we say 10% of that school population had cavities, we can learn about that. We can help those kids get to the office where you can't do telehealth to do a filling, but we can only get those that population to go and get this done. I think there's a great opportunity in orthodontics, which I've seen already telehealth being used in that field. So I think it's something that we'll be getting very used to, and it's going to be part of how we intake health. And that being in medicine, mental health, physical therapy, dentistry, you name it. I think it's going to be part of who we are and how we deliver health.
Yeah. Now, speaking of traveling, do you attend many dental conventions or gatherings?
I do, as we have many conferences through the Hispanic Dental Association, and as we try to remain a presence. Mm-hmm. So we do attend a lot of conferences. I was just in San Francisco for the ADA conference, and also for the induction for the FICD, and it was awesome. I still think there's a need for in-person conferences. You might be exposed to things that you didn't know about in the field, supplies, these kind of things. Mm-hmm. But also, I think which a lot of people don't talk about is just the networking and how important it is to continually have a touchstone with your colleagues and see how they're doing. See what's going on, what's new. Say you hear a friend and he has a CBCT, and say, how is it? And you trust his advice. You can certainly do that on the phone call, but it seems like when you go to a convention, it becomes a lot about dentistry, and everybody gets really excited about it again. Sometimes we need that.
Yeah, that's awesome.
Yeah. So, and then I'll be at the Greater New York meeting here at the end of the year. The HDA does a mini conference just before, and been doing that for 3 years now, and it's a great time to be in New York. It's a lot of fun. Yeah, I still attend these meetings.
Now, Dr. Alamo, do you have any advice that you would give to newer dentists entering the field?
Yeah, I was thinking about this, and there's so much. There's definitely so much. And there's a lot of continuing education out there, and they're all very, very good. I would say two things. I would say do research on these comprehensive CEs out there as it pertains to someone like the Coy Center or SPEAR Study Club, Clinical Mastery Group, and see it through. It can kind of be like your 5th year of dental school. You learn so much in that time, and you'll find mentors who you can continue to work with, and it's a great thing that you can take with you. As part of those continuing education seminars, I think occlusion becomes one of the most important things that we learn in dentistry. If we learn about how to make occlusion in harmony with your muscles and your condyle and the mandibular fossa, we can take patients out of pain. We can set all sorts of prosthetics, prostheses, crowns, without them breaking. It saves you from a big headache, and you can really help your patient out a lot by learning occlusion. And I think that's really important.
Yeah. Do you now? Obviously, we had that the application that you had helped develop. Do you have any other projects that you're currently working on that you'd like to promote?
No, I think between the startup and what we do also is I go speak at the University of Texas and at St. Edwards because they're local, and I talk to their pre-health program, and I present dentistry as a career path. And so I'm really involved in mentorship, and I really do think that that's where the power of growth is. I talked about doing continuums and CEs, and that's a mentorship very much. And I like to do this at the college level to talk with these kids. So they come to my office and they see what it's like to be a dentist, and they choose if it's something that they like and want to pursue. or they say like, no, it's not something I want to do. A few years ago, I had two students coming through here. One of them was sure he was going to do pre-med, and he came to the office and really liked what he saw, what we were doing. He got accepted to medical school, and at that point decided that he liked dentistry. And he forewent that year medical school, applied the following year, and now is in his second year in San Antonio. And so, I think exposing students to all sorts of healthcare fields, if that's what they want to do, is really important because you don't know. And sometimes you can kind of get a tunnel vision into one area and think that that's all you want to do. And so I like to provide that opportunity for these kids to see dentistry. And I stay in touch with them. And, I only started doing this 4 years ago, and it will bring me great joy to see them practicing and for us to get, more into dentistry and what they can do to become better dentists.
It seems like 2019 has been a really great year for you. So.
Oh, yeah. Super busy. A lot of fun.
That's awesome. Well, Dr. Alamo, I really appreciate you taking the time to get on our show. We'll be sure and have all your information, the links below, so that our listeners can go ahead and click them and follow up on that. Again, thank you so very much.
Thank you very much for having me. I really appreciate it. And, have a good day. Thank you very much.
You too. Take care. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.